Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a quick video about this fantastic patient result that I recently had in my practice. And it's just so great that I just wanted to post a quick video to share about it. I know most of my videos are around complex chronic illness like Lyme disease and histamine intolerance and methylation issues, heavy metal issues, mold issues, etc. But I do have a significant portion of my practice where I work with doing different types of injection therapies to help heal up damaged tissue that patients are dealing with. So whether it's arthritic joints or sports injuries or other injuries or what have you. So one of the therapies that I do a fair bit of work with is something called platelet-rich plasma therapy, which basically involves taking some blood from a patient, spinning it down in a centrifuge, separating out all the blood components, and basically re-injecting the platelets, so the little blood clotting factors, and plasma, some of the liquid component of the blood, into the damaged tissue. And the reason we do something so wacky is because platelets, in addition to clotting our blood when we're bleeding, like if we have a cut and we're wounded, they also release growth factors as well to help heal up damaged tissue. And this therapy's been around for a really long time. So this patient that I was working with, I've been working with this patient for maybe 4 months or so, give or take, and we've been doing these monthly treatments, and this patient's was having some really severe issues with their shoulder, to the point where couldn't really play with their kids properly, couldn't work, had been like out of commission for about 2 years before they started working with me. And doing physiotherapy and this and the other thing, and that's great, but like the individual in question had some significant issues with their rotator cuff. They weren't a candidate for surgery, so they're just really kind of backed into a corner, so to speak. So we've done about 4 treatments, and just after the last treatment, the patient was just so happy. Like, the shoulder is pretty much like 100% back to normal, like just functioning beautifully, and they're able to play with their kids, and works on the docket now, and it's just it's a really, really beautiful thing, because without platelet-rich plasma therapy, I'm not sure how else this patient would have been able to get basically their normal life back, so to speak. So anyways, it's a wonderful therapy. Not everybody knows about it. Unfortunately, PRP, the acronym for platelet-rich plasma therapy, is not taught about in mainstream medical school. It's not taught about in naturopathic medical school. Whenever I lecture at my old naturopathic school, I do my best to find an excuse to bring up things like platelet-rich plasma therapy, so at least students have some exposure to it. But unfortunately, it's just not part of standard education models. But in my humble opinion, it should be, because it can be really, really helpful. There are dozens and dozens and dozens of human clinical trials that have been done over the years. And one little add-on bit of information I'll mention is where I've been doing PRP therapy for 7 years or so, give or take, done thousands of injections over the course of that time. One of the things that I found to be incredibly valuable is combining the PRP with ozone therapy. So when we do those injections, I inject the PRP into the joint or the site where the damaged ligament or tendon is attaching to the bone, and then before removing the needle, so basically the needle's attached. I should have a prop really, but basically needle's attached to the syringe, needle's inserted into the site where the solution needs to go. I inject that solution into the needle, or into the tissue rather, and then I use my hemostats to pinch the hub of that needle to take my PRP syringe off. I have a second syringe full of ozone, attach it to the same site, and then inject that into the same tissue. So the patient's getting both PRP and ozone mingling together into the same injection site. And the beautiful thing with that is it makes the treatment a lot better tolerated. So the post-treatment pain level from PRP, because it can be a bit sore afterwards, is usually markedly less when we use ozone. And the treatment outcomes from my clinical experience are just dramatically better. I've had many patients over the years where they've had PRP done elsewhere, like they fly to Florida for the winter months and they get PRP down there, or they've worked with other clinicians where they haven't used the ozone. I'm like, yeah, PRP, it helps. I love it. Like, I'm making some progress. We add in the ozone. They're like, whoa, way better tolerated. And I made, I improved, triple the amount that I did with that one ozone PRP treatment compared to how I did with just a standard PRP treatment. Of course, results may vary and all of that. It's not a hard and fast truth for everyone, but I have seen that. I've heard those types of reports from patients time and again. And the beautiful thing with ozone is that once a clinician has an ozone generator, it's very, very, very inexpensive to generate ozone moving forward. And so, at least in my practice, at least if a patient came in and said, "No, I am diametrically opposed to the idea of using ozone. You can only use PRP with me," I would say, "Okay, it's the same cost. If we add in the ozone, we don't add in the ozone, it doesn't make a difference. So it doesn't create a significant additional expense for the patient to bring in that ozone, which is lovely." So I will leave it there. And if anybody has any questions about this topic or anything else, don't hesitate to post it in the comment section below, and I will leave it there.